Hello, everybody. Dr. Tammy Penhollow, Precision Regenerative Medicine. We are getting ready to go live with Acorn Biolabs. So I'll have Instagram and Facebook live on this side and YouTube right here. It's so great to have you. Bring your questions. I'll try to moderate the YouTube. I will have Faith from Acorn Biolabs on the other end, and she'll be moderating the questions that are coming from Instagram, Facebook. So thank you and welcome. Our topic is cell preservation. It is a physician question and answer with Acorn Biolabs. So we're going to be talking about that specifically. If you've never heard of them, they are a company who does cell banking of your hair follicles. And I love that because it's something that you can save, not unlike the cord blood, if you ever did that for one of your kids or if you had it when you were a kid, but it's pretty easy. You don't have to get pregnant and collect an umbilical cord cells to do that. You can simply take some hair from the back of the scalp and we send that in, and it can also be cryopreserved. So I'm super excited about that. And if you have any questions already, please go ahead and send those in. We will answer questions on this, as well as Faith will help me answer the questions on Instagram. Welcome again. Going live. Okay. Hello there. Just getting connected here on the Instagram live. It'll also go to Facebook. We've got Acorn Biolabs are accepting me into the live room right now. Hello there. Can you hear me, Faith? Let's see. How about now, Faith? Can you hear me? All right. Open. I can hear you.
See what's going on.
I can hear Faith now. It says I'm trying to go live with you. Can you hear me now?
I just sent you another invite.
Okay. Can you hear me? Sorry, everybody. We are having a little bit of difficulty here. That's okay. We are going live on YouTube and on Instagram. Trying to co-host now. Join live. All right. Now you invited me as a co-host. That's fantastic.
1 second.
Okay. Join live. Hello.
Hey, I'm going to do a practice and see if you're able to join, but it's saying that you're unable to join.
I'm pressing live notifications. The live video ended.
Okay, wait 1 second. Let me send you this.
Because I got the 2 invitations. The second one was to actually be a co-host, and that seemed awesome.
Okay. Are you able to get this practice one right here?
Let me see. I'm looking. I don't see anything from Instagram right yet. I've got notifications open, so I do get them.
What did you get when you were clicking accept?
It looked like it accepted, but it didn't. It just kept saying join live, join live.
Oh, God.
That's okay. Hey, everybody, we're just getting everything set with regard to going live with Acorn. We're trying to go live at the same time on Facebook and Instagram. Welcome. And we will get started here ASAP. We're just trying to get live on multiples here. So we're talking with Acorn Biolab about cell preservation, specifically from your hair follicles. Stick around, I promise. Here's a live video option. It says we have joined, and let's see if we're good to go. Request to join. And thank you again for being here on our YouTube channel. We are trying to go live on multiples. Acorn has requested us to go live here. Says that we've joined. This is fantastic. So if you've got any questions, I will be moderating the YouTube aspect of it, and I'll also be answering questions that are coming off of Instagram. So Faith will be going to read those questions, and I'll read them out loud so that you can hear them for sure. And we'll go on here. It looks like we are good. Share the live video as our moderator. Good. All right. So we are ready. Turning on the camera, that is good. I am ready to roll. And if you've got any questions, please let me know. We will go live here with the camera. Join the live. Okay, looks like we are getting ready to go live here. It's showing us now a new screen. Just waiting for the camera. Technical difficulties. What questions do you have? I can answer a question on YouTube right now, and we can get the questions on Instagram here in just a few minutes. Thank you very much for your patience with this. Loving the energy here. I know we've got somebody here. We are going to talk about future-proofing our health by collecting our own stem cells. And it's not for use at this moment, but like maybe you were a kid who had their cord blood collected, or maybe you were a parent who saved the cord blood for your kids, and now you're saying, what about me? What if I want something for the future? So that is what we are talking about today with Acorn Biolabs. Just trying to join them live, and it looks like we're having some difficulties there. But if you've got any questions right now about how to preserve your own stem cells from your hair follicle, drop them in the question bank and I will start answering them. So what it is a collection and cryogenic storage of your own cells at a time that those cells are biologically healthy. It's not currently a treatment or a cure or a promise of future use, unless we talk about what's called the secretome. We're going to drop into that specifically. That's for things like hair and skin and nails. That's what the secretome is currently. I'm most excited about the future. So let's see if I can't get live here with Acorn. All right. So it says that we've joined, and that the live video is paused. All right. We are here. Faith, can you hear me? I see that we're live. It says the live video is paused. and I'm not sure why, but I am here. I am definitely here. If you can see me, I am request to be a moderator. Go live with Acorn. Request to join. All right. So it's not a treatment right now or a cure unless we're talking about specifically the secretome, which deals with the ectoderm. We're going to do a little bit of a biology lesson, but when we're born, we've got 3 different germ cell levels. We've got the endoderm, which is the inner things, the tubes of our intestines, our esophagus, all the internal organs. We've got the mesoderm. Faith's trying to call me. I'll be right back. I'm not sure if it has to do with number of followers or not, because I think you guys have enough ability that you're the hosts and that you should be able to have a moderator or share the live with somebody no matter what. We are finally live on both Instagram as well as on YouTube. So I'm going to hang up the phone and let's get started.
Okay.
All right, join live. And we are live. With the hang up of the phone, I think that might have hung up the video, but we're going to try that one more time, I'm sure. I will send her a text message and say, send again, hanging up. There we go. All right. We have joined. I'm going to request to join your video, be live. Okay, we now have Acorn Biolabs on the Instagram here. I'm looking for the camera.
I'm unable to see you.
Yeah, I can't see me either, even though we've got the camera on. There we go. Now we've got it. Okay, let's do this.
Yes. Hi, everyone. Thank you guys for being so patient as we navigate some technical difficulties, but we are live. I am Faith Barba. I'm here with Dr. Tammy Penhollow, and we are going to be talking all things stem cell thinking.
Hi, I can't see you right now. Faith, can you see me? Saying the invitation expired.
I'm not sure if I'm frozen or
it's not showing.
Frozen.
I can hear, but not see. All right.
I think you're frozen.
No, I'm not frozen. Not sure. Looks like we've got 5 joiners. Can anybody who is live right now see me? I see that I've joined. Can anybody see me or hear me? So the live video is ending. We are trying to go live on Instagram. We are live on Facebook, and we are live on YouTube. Do you have any questions for me before we get started while I'm still trying to go live on Acorn with Instagram? All right. Says we've joined. That's good. So what we mean about future-proofing your health, we mean that we're collecting your own hair follicles. And in those hair follicles, we have the ability to bank those. Kind of like we talk about the cord blood, where you might have been a kid and your parent collected cord blood for you, or you collected your child's cord blood, but you thought, what about me? What about if I wanted to have my own cord blood, my own cells collected, but I was born before cord blood was a thing? Well, now we can do something like that, and we can kind of stop the clock and get our own cells from our hair follicles. And it has the ability to go onto the endoderm, which is the inner cell. It goes into the mesoderm, which is the muscles and myofascia, and it goes into the ectoderm. Let's join Faith live.
Hi, everyone. Thank you guys for patiently waiting. I'm am Barba. I'm one of the practice development managers here at Acorn, and I am with the wonderful Dr. Tammy Penhollow out of Scottsdale, Arizona. And this evening, we're going to be talking all things stem cell thinking, what it truly means to serve your youngest self. So, after some technical difficulties, we are live.
We are, finally. Hello.
Hello. Dr. Penhollow, if you want to make a quick intro about yourself, your practice, and then we can get started.
Hi, Dr. Tammy Penhollow in Scottsdale, Arizona. I am a musculoskeletal specialist. I deal with anything joint and spine related, and we're always talking about using your own cells for things like a rotator cuff tear or a ruptured disc or pain due to those things. And right now we can use your body's own stem cells from bone marrow or from adipose. We can also use blood, which doesn't have very many stem cells. So when I learned about Acorn Biolabs and the ability to preserve your own hair follicles for the future and potentially see what's coming down the line for musculoskeletal health, I was hooked.
Perfect. So let's get into it. Let's start with what it means to future-proof yourself.
What we mean by future-proofing your health is not talking about guarantees or replacing medical care specifically. We're talking about opportunity. We're talking about how medicine is evolving so rapidly, especially in regenerative medicine, which is my field. And we want these cells to be able to signal repair and signal regeneration and biologics. So preserving healthy cells today, while they're youngest that you can be, may provide access to these future therapies that don't yet exist, or they're still being refined through a lot of research protocols that are being done right now. So the goal with future-proofing your health is preparedness, not specifically prediction.
Perfect. And who would be a candidate for this hair collection and harvesting and preserving your youngest self?
Candidates right now are over the age of 12 who have viable hair follicles. So there's not a strict upper age limit. In fact, I've collected from mid 70-year-olds who plan on living very well and thriving for the next 30 years. What matters most is actually the health of and the integrity of those hair follicles at the time of collection rather than your chronological age.
Perfect. And if a patient were to walk in your door and let's say the patient doesn't have hair follicles to collect, this would be a bald patient.
Sure.
Can they be a candidate for Acorn?
Unfortunately, right now, hair scalp follicles are specifically selected because they contain consistent, well-characterized follicular stem cell populations. We just don't have the same kind of anatomy in our eyebrows, the chest hair, or other body hair. It doesn't reliably provide that same cellular architecture or yield. So something theoretically possible is not necessarily the same as being clinically appropriate.
Yeah. And what about someone undergoing chemotherapy? Are they a candidate?
You know, timing really matters when we talk about chemotherapy or even radiation or even other things that are suppressing your immune system. A lot of people right now are on things that help with psoriatic arthritis or ulcerative colitis, things that actually suppress your immune system. So ideally, we do this before. If you know that you've got this diagnosis and you're going to start chemotherapy, you would ideally preserve those cells before the treatments begin, because once it's started, that cellular yield from the hair follicle may be compromised.
Yeah. And now let's get into cord blood versus harvesting your stem cells through the hair follicle. So just high level, can you tell us about cord blood banking?
Sure. High level. Cord blood, it doesn't expire. It's not like if you are now 24 years old and your parents collected your cord blood 24 years ago that it expires. The cord blood is cryopreserved and it can remain viable for decades, provided that the storage is perfect. The limitation for an adult using their cord blood is typically a cell dose issue, that sometimes there are even double packs. If cord blood it was collected at your birth, there's a finite number of cells because there's only so many cells within the cord itself. So adults require larger cell doses to do things like transplant scenarios for a blood-based cancer or a bone marrow-based cancer. So that's the limitation of adult cord blood transplantation, but it's not like it expires.
Yeah. And so if cord blood is only useful for children, essentially.
Well, you could say potentially, right? That's where those double packs, if there was an actual whole bunch was collected when you were born, that potentially, depending on the indication, is it something that in the future could potentially go down to do enough to go into an elbow tendon? Maybe. But is it enough to go and treat you with an adult sized body and an adult sized blood cancer? Probably not.
Got it. So let's dive into acorn secretome. What is a secretome?
This is where we can definitely talk about not just the probability, but the actuals. So the secretome is the collection of signaling molecules that release growth factors, cytokines, extracellular vesicles, exosomes, basically. And they can currently be used for things that came from the ectoderm layer. I was starting to explain that a little bit on the YouTube channel, that when we are born, we've got 3 different germ layers. Ectoderm meaning on the outside. So what's on the outside? Our skin, our hair, our nails. And currently, acorn does allow us to create the secretome from these hair follicles that we collect. And what's so exciting about it is that we're looking for the ability to maybe help after a plastic surgery or a big laser treatment where you've got wounds, you've got scars, you've got the damage from the laser, and you can put the secretome on it and your body's own cells go to work saying, oh, I remember what this skin's supposed to look like. Let's make it pretty again.
Exactly. And can you walk me through what that process looks like with the hair collection?
Oh, sure. Yeah, this is super simple. The collection is, well, first I'll say what it feels like. It feels like little tiny plucks of the hair, but it looks like booking an appointment for about 30 minutes, coming in and maybe just scrolling on your phone while I wash off the back of your head, and we collect from about the top of the ears back in this area here, and we're taking little hairs from these areas. I collect in that 50 to 70 follicle realm. And we then put them into a special little vial that has something that preserves them, that is tightened. We fill out your information and it's sent on a big cryo pack to the lab where it is then stored, it's preserved, and you can decide to turn some of those cells into secretome. But a couple weeks after we send it, you get a report that shows a picture of one of your beautiful little bulbs and says how many we actually got during that.
Yeah, how exciting. And I know this is a common question that you get during the collection. Will I have a bald patch if you were to pluck 50 to 70 hairs?
Yeah. For context, the average person naturally sheds about 50 to 100 hairs a day. So the loss of in that 60, 70 hairs is not taken from one single spot. We don't just take and create a little bald spot from that. The collection is very distributed, kind of in that line on the back between the top of the ears based on what we're getting. If we got a really nice area that's this big where we're getting the best looking follicles, we'll hang out in there, but we can also go a little up, a little down. So no, you won't get a bald spot.
Yes, you will not get a bald spot. And then after your treatment, so patient leaves your office, can you walk us through the window of when the secretome will be created?
Well, I don't have the exact date on how long it takes to make the secretome. I know that we get a email as the physicians who do the collection about the same time that the patients do, that says that your cells have been accepted and they've been analyzed and they've been properly preserved. I would imagine that it would only take a couple weeks from when you tell me that you want to utilize that secretome, that we then have it in the office and we're ready to do what you would like with it, whether that be injecting into the scalp for hair loss or injecting into the face, microneedling into the face like I would normally have done with PRP.
And what happens if someone stops storage with Acorn?
So if Acorn is with someone decides not to continue the storage, but Acorn is still a viable, vibrant business, then they have established protocols. And it says they're going to manage the discontinuation responsibly. And they're outlined in the storage agreement that follow ethical and clinical standards that is regulatory.
Perfect. And any other additional questions that you think we should go over?
Well, I'm seeing if anybody's come up on the YouTube yet. What about culture expansion? I've got a question. What about culture expansion? So what that means is we're taking these cells and we're under controlled lab conditions, culture expanding. Right now, there are several studies and the number of about 240 that Acorn Biolabs is doing. So it's not live for prime time. The secretome is live for prime time. Where I'm excited as a musculoskeletal physician is I'm thinking specifically about the other germ layers, where we talked about the endoderm, and that's your internal organs. So think even your colon, your pancreas, your kidneys, those things, all the way to the mesoderm, which is the middle layer, and M sounds for musculoskeletal. So tendons and ligaments and joints and muscles. So that's where the promise is. And right now, all we can culture expand is within the regulated, FDA regulated studies. So right now there's some fat culture expansion and there's some bone marrow culture expansion. And I know that Acorn Biolabs is also doing many different studies with the other germ layers as well.
Yeah. And I know this is also a common question that you and I both get, but just for context, the other two ways to access the same stem cells that we do through the hair would be through bone marrow and liposuction fat. So with Acorn, it's truly such a non-invasive way to access and preserve those same stem cells.
It is. I've done adipose collection and I've done bone marrow collection. I do an average of 2 or 3 bone marrow collections a week. And it's not a quick little 30-minute procedure in the office where you're scrolling on your cell phone. It entails quite a bit more. And right now I can use it same day, but I can't expand it and I can't use it for the culture expansion at this point without being under an FDA authorized clinical trial. So it's a lot more invasive, and liposuction is liposuction. This is a medical liposuction rather than a cosmetic one, but think of it with the same thing. You have to have anesthesia. We need to inject the tumescent solution into the area, and we literally need to disrupt that with kind of a sawing kind of motion with the liposuction and suck out the fat and then send that. So it's a totally different situation.
Yeah. And if a patient were to come to you and say, hey, I'm 65, I should have collected my stem cells when I was 35, how would you best answer that?
It's definitely an individual conversation. And that's what I've had. I told you I had even a patient in his mid 70s, but he has no comorbidities. He's not diabetic. He has very well controlled blood pressure, no medications for that. He does have some mild sleep apnea, and he has a BMI that's in the 26, 27 range. He's not on meds. He does use a CPAP for his sleep apnea. He's a good candidate. He has a long lifespan ahead of him, and he wants to turn that into health span. So absolutely, after a counseling with him and talking to him about the risks and benefits and his alternatives, he was 100% ready to do that. So I think that having that kind of a conversation, it's not a fly by night thing, that really have a conversation with the physician and talk about what your risks are, look at your overall health and what your goals are for the future. If that's to remain super healthy and super active, and you recognize that we're talking about potential rather than a absolute inevitability that we'll have these cells in your lifetime, then I'd say that in his case, and like it may be for you, that the benefits outweigh the risks.
Yeah. And let's touch on family banking and the importance of having that opportunity to not only bank myself, but my family as well.
Absolutely. So I know that my practice, and I'm assuming that other practices will do a maybe a family banking day, and I've had people come into the office and they're lined up. We've got from 12 and above, and they're ready. And Acorn does an amazing job with the actual banking rates itself, and we'll give you a family discount. So to bank the cells and know that your entire family is kind of taken care of is a little bit of that peace of mind. We call it a biologic insurance policy.
Yeah, exactly. And I know I had mentioned this before, but we all have a life insurance policy. But what about ourselves? Having that biological bank of our healthiest cells is really important.
It really is, because we don't know what the future holds. And I'm super excited about the possibilities. Now I know for sure we can use it for the ectoderm. We can absolutely do that. And that could even be a burn, right? You could get a burn and we can use the secretome for that. So it doesn't have to be anything that is aesthetic. I know that a lot of people are using it for aesthetics, but you can think outside that box. I'm thinking about the future and the possibilities, because I don't hope to ever use my car insurance. I don't hope to use catastrophic medical insurance. I don't hope to need a biologic insurance policy, but I still have each of those.
Yes. And I'm looking through the live now. I'm not seeing any questions. I'm not sure if there are any questions on your YouTube as well.
We're looking here. We talked about the age. We talked about a not a good candidate, and really that is that acutely ill. We didn't mention that. We said maybe not chemo, maybe not radiation, and if a person is completely bald on their head. But say you're undergoing an acute inflammation or an acute infection, that would also not be the best time, because your cells are a little bit inflamed and your body's not at its most vigorous, so that we can just postpone for a tiny bit. But other than that, I'd say we're good.
Yes, and it looks like we have a question here. Does this hurt? No, a lot of patients like to compare it to tweezing the eyebrow. It's painless in my experience. Dr. Penhollow, if you wanted to add to that.
Absolutely. Like I said, most people are just playing on their phones, and we're doing a little chat as we're doing this and just talking about whatever it is they came in for. I do have a conversation to run into, do a little distraction, but it really is a quick procedure. It takes less than 30 minutes from start to finish, and that's filling out paperwork.
Yes, exactly.
Great question, though.
I agree. Any other questions from the crowd?
Let's see here. Yeah, so we talked about what happens after the follicles are collected. Faith, what is the current turnaround time for the secretome?
Yes, so the window when you get collected, there is a 60-day window for secretome creation. And what this means is that in our lab, we are waiting for the regenerative material, so that's the exosomes, growth factors, all of that to be secreted from the stem cell, and you will have your secretome back in the office within 60 days.
Love that. So 60 days, and that's not because it's slow. It's because we're allowing the biology to do its job, and those cells are doing their turnover and doing the secretions of the secretome. I love that. One more question. What do we not know yet? Well, we don't know all the future indications, right? I know that. Can we share a couple of the things that are being studied, Faith? I mean, can we talk about things like insulin-dependent diabetes, and that we're studying things, for the musculoskeletal system, osteoarthritis, etc.? Can you expand upon that a little bit?
Yeah, definitely. So in our lab, our amazing lab technicians they're able to expand these cells into, we're going to be able to use your secretome in orthopedics and wound healing and future regenerative treatment. So that's why it's so important to bank your stem cells now to have options for, the use of our secretome in the future.
That's why we're doing this. That's why, as a musculoskeletal doc, I'm so excited about this. Is, again, when we age, we have fewer stem cells in general. So wouldn't it be nice to know that when you are 60 or 70 or 80 and you need that new hip, but you collected your cells when you were 35 and they were at their youngest, that they can be expanded over and over again if we get the authorizations for this. And this needs to go through regulatory, obviously, and it needs to be studied. But the excitement is the options for that future.
Yeah, exactly. And I think that just ties back into having that biological bank and having that resource as regenerative treatments are available to us in the future.
Absolutely. And we're again saying this is about preserving options. We're not promising outcomes, but the possibilities are what are so exciting and what keeps me going with this.
Yes, well, that's great to hear, Dr. Penhollow. And thank you so much for joining us live and discussing stem cell banking.
Absolutely. Thank you so much. And thanks for hanging in there, everybody, for the little tech glitches, but we made it.
We did. Well, thank you everyone for joining, and I hope everyone has a great night.
Take care.
Bye.
Bye.